excited. Thank you so much for joining our live event.
Yes.
As you guys hop on, make sure to say hey in the comments so that we know that you are here. Everyone that joins is going to be getting $50 into their account tomorrow as a thank you for joining. So definitely make sure you say hey when you hop on. We have added a little something extra this time with making sure that you are hitting the like button and sharing our live. For doing that, we are actually doing an extra raffle. So make sure you say, hey, you like, and you share.
So we have a couple of people here already tuning in. That's wonderful. We have Lori, we have Lisa, we have Kathy, Jane, Michelle, Robin, Jessica. Hey everyone, thank you so much for joining in. If you like my get up, I'm like planning all this my Halloween stuff. Of course, I have to be my own surgical patient.
Dr. Mir is healing from some surgery that we have going on here. Hi,
Okay.
Camilla. Welcome.
Oh my God. Oh, that's so exciting. So a lot of people joining. Hey, Lydia, Cindy. So wonderful. So today, we are going to do our little bit before and after and talk about non-surgical skin rejuvenation, overall facial sculpting, skin care. We're going to show you some before and after, and we're going to mainly focus from the Botox lines and the fillers from the same line, which is Alargan. Also going to talk about some BBL and IPL. But if you have any questions, anytime, please feel free to ask your questions. And you have to do any comment, please feel free to do that. I'll be more than happy to answer. But um, I'm just going to go ahead. We had made some before and after. We're going to look at some patients or our wonderful clients, and we're going to just pick up and see the before and after, that why they were so good candidate, what was after result was. And I appreciate you all guys being here. So Amanda, why don't you go over about
Our specials. So our specials are super exciting. So we have Botox right now, $8 per unit if you buy 50 units or more, which is such a good deal. So many people have been banking their Botox on their account, which is great. We have a buy one, get one 50% off Juvederm fillers, which is another amazing deal. We also have buy two, get one free for Juvederm filler.
So, and a Juvederm fillers, you can use any type of filler, buy to get one free, like you want to do your cheeks with lips, or just the nasolabial folds and or the fine lines around your lips. So we have like 5 types of Juvederm family: Voluma, Velour, Volubella, Exi. So you can definitely mix and match and change afterwards. So this is really good deal, and we have a special on microneedling.
Yes, we have a buy two, get one free for microneedling with PRP, which is everyone's favorite vampire facial with liquid gold. It's such a good treatment to have. And we also have a buy two, get one free for the IPL BBL treatment, which takes care of pigmentation, any red spots, anything like that.
Yeah, the IPL and BBL is a great treatment for skin rejuvenation. It makes your skin even tone, takes care of broken capillaries and redness, brown spots. So in this picture is it is done by a Vizia, the skin analysis, which can see deeper in your skin, so you can see more clearly where the inflammation, broken capillaries, and all of that going on. And 2 weeks later, you can see the after picture, that how much redness, broken capillary is reduced. So we do this in-depth skin analysis after the treatment. Very common in warm weather like Florida, like people has rosacea going on, a lot of sun damage going on. You can see how much it improves. So if you see more the basis of like, you can feel your skin looks better, your pores are better,
Yeah.
it's more plumping, but you can see more subjective or you can quantitative results. It's kind of more reassuring that how wonderfully it works.
Yeah. And I really like after seeing like this picture here,
Yeah.
seeing how bright and even toned the skin looks.
Yes.
It's beautiful. I love the way
Right.
it
So
makes the
it's a
skin look.
really, really good treatment for
Yeah.
non-surgical skin rejuvenation. You can see in this young lady, like if your whole face is more nicer, brighter, lighter, even tone, and skin is better, you just look more younger,
Yeah.
um, and healthier.
Yeah,
Even
absolutely.
if some people has like blotchiness of the skin, some freckle mixed with age spots, redness going on. So if you tone that down, it is a really great anti-aging in Florida. So you see good result even after 1 to 2 treatment, and maintenance maybe like for some people once in 6 months, one in 8 months, or one in a year. It's really really good, and a lot of people here we can say appreciate the the results. Robin said love IPL. Gail said hi. So hi everyone who just joined it now. So
So what
thank
is
you, Robin. Yes. Somebody is asking why the mask. Well, we are sitting so close to each other,
yes.
so we have to stay from each other. So
Yeah.
we have to.
Gotta stay safe, gotta wear your mask.
And yes, the mask is also like it's not like a great thing to wear, but and people having acne and skin problems with the
Mm-hmm.
mask. So to kind of take care of that, the skincare regimen, one of our like wonderful like yourself esthetician can go over and look like what cleanser should use, how to definitely take care of your makeup, remove your makeup
Yeah.
after you go home, your sunscreen, moisturizer,
Yes.
and hydrofacial is a really really great treatment. Um, so if somebody's having condition going on, doing that, so that's why it's so much high in demand nowadays because of these masks, and we are skin is so congested.
I know. So definitely just some key points with the mask knee to just definitely make sure that you're changing out your masks. If you have the cloth masks, make sure you're washing them. Another thing too, if you're washing them, try to use something that's not scented when you're washing them because that can cause a little bit of irritation.
Yes.
If you're wearing makeup underneath your mask, you definitely need to make sure that you are washing your face every morning, every night. And then, of course, skincare products are really going to help you in this. With the mask knee, bacteria is just happening. We're hot under here. We're sweaty under here.
Yeah.
So you're definitely going to want to try to get
So Brandy
something.
just said that she has hydrofacial. She loves
Yeah.
it. So great to hear that. I love this treatment. Have to have it. Of course, Robin's asking about IPL. Absolutely, we have sale on it. I think it's buy to get one
Buy
free.
two, get one free.
Right.
Yes. Yep. So you guys
So
can call in and purchase that over the phone, goes to your account and stays there until you want to use it.
So just briefly want to go over today like non-surgical skin rejuvenation and facial rejuvenation. So we talked about IPL and we talked about how to take care of your skin at
Yep.
home. And then I just going to like divide into face into like three categories. Like upper 1/3 right here, lower 2/3, which is more volume, and our neck, like jaws area. So here, like most of the lines here and here, we reduce by doing Botox. So these are the lines we made by making a lot of expressions. And if you relax those muscles of expression, we take care of the lines. So this is example of like crow's feet or the lines around the eyes, how doing the Botox can relax that and makes it look younger. Also, the same thing we can do in between the eyebrows and in the forehead. And rarely, like we do it around the mouth. So if somebody has like gummy smile, so on the teeth, like you can see nice little improvement. We don't have to use a lot here. And some people have like strong DAO, that's the name of the muscle. When you pull your mouth down, you make this frowning look to kind of relax that. Um, yes, we can definitely call in and pre-purchase units, and you can use it whenever you want. It's still going to be in your account. Um, so and a little bit just like 2 to 4 units around your upper lip lines or lower lip lines. That's another example that's an example of lip flip. You can see from one picture to another that your lip looks a little bit more plumper or bigger without any filler. So that also can be done by Botox. It's really subtle, but for some people, it's really natural and enough to give them, the plumpness.
Absolutely, yeah.
So very popular in social media nowadays is called lip flip. So this is an example of like for orange chin, like chin has a lot of dimpling. I saw relaxing those dimpling with the Botox also give you smooth chin and your lower face is more enhanced. So these are some example I gave where you use Botox. And now we're going to go over another example how we use little bit Botox in the forehead, so relaxing the forehead lines. Um, so these are the areas we use with the Botox. And please feel free to ask any questions. And now I'm going to go where we use fillers. What is the filler? So filler is the volumizing your face.
Yep.
You know, when we age, we lose our volumes, which start using from our temples, around the eyes, cheeks, nasolabial folds. And this more volume, some people have more like around their neck,
Yeah.
goes there. So most very popular, like this is a young lady, this is a patient in the picture. That's for lip enhancement. She has like she's young, she has nothing wrong with her face, but she just wanted her upper lip to be more plumper and balanced as compared to the lower lip.
Yeah.
And that's what we did. Another very popular treatment is like cheek enhancement in the younger population. We are not doing this for anti-aging. We are just doing for enhancement.
More contouring
Yes,
the face.
yes. This is rather more for anti-aging. Like people start having some lines, like smoker lines around the lip.
Mm-hmm.
So there's a two-way to take care of it. We can do a deep laser to take care of them, but most of people don't have a skin type or don't have the, you know,
The downtime.
the downtime, which
Yeah.
can be long. So we take care of that with a filler called Volubella, which we use for fine lines. So that's the kind of a result or after that filler around the mouth. Another example where we use filler. So we, in this case, we used velour and volubella. So you can see the marionette lines or puppet lines around the mouth, which can like, sometimes looks like tired. So doing that and right here and around the lip, giving just tiny bit. She doesn't want her lip to be like huge or big, taking care of the line around it. Um, gives you very natural, subtle improvement.
It's giving her shape back of the lip.
Exactly.
Yeah.
Yes. So another very good area is your cheeks and under eyes. Sometimes the under eyes bags, we call it, can be genetic, or sometimes you have allergies.
Mm-hmm.
So you see that groove, we call it tear trough. And when we put a little bit filler there, it lets you make more rested,
Mm-hmm.
enhance your look. This is another example of filler in the tear trough or around the eyes. And sometimes we do like cheeks with under eyes, and everybody's different. So we have to customize the treatment accordingly.
The under eye is probably one of my favorites
Yeah.
just because of how rejuvenated it makes you look.
Right.
It looks like you had a really, really nice sleep.
Isn't it? And
Brandy says she
right,
needs
and
this.
it's like the under eyes are most like easy and the most difficult areas to
Yeah.
do, but because not everybody knows where, how deep to go and how much to put the filler.
Yeah.
This is the example for nasolabial fold that's called the laugh lines, and just
Mhm.
doing tiny bit in a very natural way enhance your face
Yeah.
a lot.
Yeah. It looks beautiful. Looks much better.
So this is a great example of somebody, we call it a liquid facelift, in which we are putting the filler on multiple areas to give that more rested natural look. Like we are putting a little bit filler under eye, cheek, nasolabial fold, and meridian line, like 4 places. So, Cindy, the filler can be under eyes, can be just 1 to 2 ml. It can be 1 ml each side, or it can be like half and half. It all depend upon person to person.
Mhm.
So either you can just get like buy to get one free, or buy to get one half off Volbella, and then we can see how much you would need. And if you don't need that much, it can always stay in your account, or we can use in nasolabial fold. So definitely 1 to 2 ml. And sometimes with under eyes, like in this case, we need to do a little bit cheeks too, because you can see the volume depletion is starting from under eyes and going into the cheeks. So we have to correct the both areas. So getting the risk under eye filler, we generally use hyaluronic acid. Hyaluronic acid is completely reversible filler. It can be dissolved, but if you're not getting it right, you can have your eyes can look worse. It can look baggy. You can see the filler through her eyes. Like you can see this lady before that, you can see tiny bit which was done like years back. So that's not a good look, but we try to kind of plump it and put filler around it so it looks much better. But if you're using any injection anywhere, like the risk of a minimum, but it can little bit swelling, bruising can definitely happen. Is going to happen in 90% of the cases. It takes like around 10 days to 2 weeks to heal completely. Um, Thank you, Camilla. So she's saying we're happy with the Botox. So as I ask you about the risk, swelling, bruising, you may not like it, which is rare. So it's completely dissolvable. But sometimes you're not even a candidate. So for under eye filler, so we really have to see you and see um, what we do. So Lydia, the product underneath the eye, I want something which is more like um, thin, goes well under eyes. So I have used Raffle, my favorite. Bolitero is another, but the Volbella is my favorite currently, which I use a lot. So Juvidum family, Volbella is going to be my filler of choice. Um, Underneath, the filler depends upon where we are putting it, and the under eye filler lasts a long time, like around 2 years or more. In the cheeks, the filler can last up to 2 years, like one year, 1.5 to 2 years. In nasolabial folds and around the mouth, 9 months to a year is the longevity, because we are in the lower face, we are working against the gravity, we are talking, moving our face a lot. So it all depends upon where we're putting it, what type of filler we are putting it.
So oh, that's a good example, exactly what you were talking about. So I just want to go into the raffle really quick, you guys, because the raffle is huge right now. We have so many names in our raffle, which is really, really exciting. And I know you guys want to know what the raffle is. So we have two going on tonight. The first one is if you like and share this live, you are going to get entered in to win a free hydrofacial. So if you're struggling with acne or anything like that, make sure you like and share, because you will get entered in to win a free hydrofacial. And then the next raffle that we're doing has a $3,000 value, which it has 2 syringes of Juvederm Voluma. It has 50 units of Botox. You get 1 IPL treatment. You get a Skin Cuticles acne kit. And then you get 1 chemical peel. So such a good
So
raffle.
it is more like whole face
Yes,
rejuvenation,
absolutely.
non-surgically.
Yeah.
And then you can maintain with hydrofacial chemical peel. So there
Yeah.
is a IPL there. There's some 2 fillers there. There's a Botox there. And so how they enter it, like whatever the purchase they're doing on the specials, with each $100 they get 1 ticket.
Yes. So every $100 that you spend going towards the event specials, you get 1 raffle ticket put in. So.
And for how long it's going? Is it just for today, or what's the last day to purchase?
So I believe the last day is going to be Saturday to purchase.
Okay. And after Saturday, we'll be done, and then we're going to announce one lucky winner on
November 2nd. So
the
November 2nd.
Monday.
Yes. I believe it's Monday.
Great.
Yeah. I believe it's Monday. So yeah, so November 2nd, we will be announcing the winner for the raffle. So make sure you guys are calling in and purchasing. If for some reason something does need to be switched, if you purchase filler and we throw out a different name at you, no problem. We can switch it around and we can make it work for you. So if you guys want to take advantage of this deal, definitely call in and book now.
Yeah, I love Super Sisters, Victoria and
Oh yeah.
Marianne. Thank you so much. I do appreciate everyone.
Yes,
Beverly,
Beverly.
you are already checked. Thank you for checking in. Evelyn, thank you for being here. Hey, Michelle, how are you?
How are you? Okay, so we do have some questions. Don't forget, guys, if you have any questions, feel free to put them into the comments. We had a couple people put in. Thank you for all the good deals. You are so welcome, Marsha. Definitely put your questions into the comments. We did have some people give us some questions beforehand, so I am just going to get rolling into those. So some people I know have questions about the difference between Botox and fillers. Some people think they're the same, but very simple. What's the basic difference between the two?
Right. So as I was just going into like what's more quick and easy non-surgical rejuvenation on the face. So we talked about like if you want to just improve your skin, like my canvas, the BBL IPL is a really great choice.
Mm-hmm.
And then which is a light treatment. You numb your face tiny bit, and with this treatment, you go all over the skin, and you can have a couple of days like with the redness, but there's no bleeding, oozing. They're gonna have some crusting, like all your brown will come to the surface, and it looks like little bit crusting. Can you show me the slide, Denise, the lag one? So I can show the IPL. So you can see that's before, and in the middle is how it looks like all your brown come like more darker, and then they slough off. So your skin looks more even tone, nice and smooth. Um, so that's our IPL or BBL. It can be done on your face, neck and chest, back of the hands, anywhere the skin you have redness, sun damage, that. So coming to your next point is your Botox. So Botox is job is to relax the muscles. So we inject like tiny bit here to just relax this muscle so it's not moving that much. It's a very thin, looks like a little liquid. We use tiny dots, very fine needle. You go to work right away. You're not supposed to like band for 4 hours, or because it takes 4 hours to bind the product into your muscle.
Okay.
So we are that's why we don't want to move it too much or exercise, or so we're not increasing the blood flow to that area. And after a couple of days, when it binds, it relaxes your muscles, and it's keep relaxing for so long. Like every 3 to 4 months you have to do it again. Most popular areas in between your eyebrows, forehead, and around the eyes.
Okay.
And we talked about like it can be used for around the mouth for like gummy smile, smoker's line, fine line around the mouth, or deal
To relax those
yes.
muscles.
But you don't feel it. It's just like a very thin product. Now it is totally different than fillers. So as name suggests, fillers is filling something, filling your lines, filling that volume deficit in your face. It is a clear, fine gel. So this is a, like example for fillers. So you can see she has a volume deficit going on underneath the eye, in the cheeks, nasolabial folds, around the mouth, and the marionette line, so perfect line. So this is a perfect example of like, um, and she got IPL too on her face. So it is a good example of liquid facelift. So how we treated her skin, the brown spots looks much better. Skin is more even tone. Then you can see that filler underneath the eye, which is going to be volubella, and in the cheek we used voluma, which is a little bit more thicker.
Yeah.
Same Juvederm family, same hyaluronic acid, but the consistency of the gel is a little bit different. So
Okay.
we pick and choose, looking at your face, that which filler is best for you. Can you please go back to that slide again? And then she has a nasolabial folds tiny bit, velour in her marionette line, and we did same the volubella, which we did underneath the eyes for the lip contouring, gives little volume in the lip and the lip line, so you can see like it's how we're doing the whole thing, enhances your face a lot.
So make sure you guys comment if you share. So we noticed that if with the like and share raffle, we can't see if some people's pages are private. So just go ahead and comment in the comment section, just saying that you shared. And that's how we'll know that you make sure you're still liking the video, and then just comment shared once you're done.
Hey Donna. So I'm so glad like a lot of people are joining in, they're tuning in now. The whoever is tuned in a little bit later. Today we are doing the event about non-surgical face rejuvenation, which includes skin rejuvenation, BBL, Botox, and the filler family.
Mm-hmm.
So this is some also filler. We call it non-surgical nose job, or like this pretty lady who cannot do surgery. She cannot do a surgical rhinoplasty because she's on blood thinner. So she wanted more straighter nose. So this result has been by Juvederm, which stays there for around like year and a half, and you can repeat it. And other area we can do enhancement is the chin. So with the like you see her like how her nose, lips, and chin come in all in the same line. So that's very balanced face. But the other picture I'm going to show you, you can see like her she has a very pretty face, and the chin you can see is like a little bit like not like underdeveloped. So putting a little bit filler in the chin balances her face and enhances her, beautiful face even more. So these are the some areas of the filler, and the voluma is uh, recently FDA cleared by chin for the chin filler.
Oh, wow.
So
Okay.
we are like doing it off-label use, but looking at that, these companies are putting their product and getting FDA cleared for new areas.
So who would you say is a good candidate for this? Anyone with volume loss, or who's
Yes.
a good
So as I
candidate?
said, I divided into younger people who want to do something enhancement.
Mm-hmm.
Like the congenitally is wanted to straighten their nose, or wanted to put more prominent chin or more prominent cheek, or a little bit of volume in their lips, or the people for anti-aging, like they're losing volume in their temples, they're losing volume around their eye, cheek. So the volume is lost, like we're losing the fat pad in our face, which
Yeah.
are plump when we are young and held together with the tight collagen. So with time, the fat pad become less, and they're also lax. So we get like little our fat pad pouch on our lower face. So we want the volume more around the cheeks to live more, to look more younger,
Okay.
and less volume in the lower face.
Okay.
So we also talked about like how liquid facelift. So we're putting more volume in the cheeks, but we want to take the volume away from your neck and for your jaws,
Right.
and that's we can do by Kybella, which is also a product from Aladdin.
Mm-hmm.
So Kybella is quick 5-minute injection, like Botox. Like you choose the area, like some people have double chin, that which area you want to treat.
I have
Yeah.
that.
So yeah, you can see the example of
Yeah,
this.
that looks
Yeah.
good.
So we treat it underneath her chin. So these are quick 5-minute injection. It's kind of a do sting tiny bit, and you can have swelling and bruising next day. This result is after 3 months. So this bind with your fat, Kybella, and then you slowly your body absorbs it. So it's a kind of a sculpting, non-surgically. in a way. We can do this treatment like same effect with the cool sculpting, but if it's a bigger area and we need to freeze the fat, then the cool sculpting come into the picture.
Right.
Or we do sometimes liposuction too. It's we good to have so many choices so that we can fit into everybody's choices, budget, lifestyle, how much downtime want to have or not want to have.
So after the Kybella, what's the downtime look like? Is there anything that they can't do after Kybella or?
Yeah, the Kybella is not like they can't do. It just little bit swelling around.
So it's sore to touch. And,
Sore attach and going to be swelling, so it looks worse before it looks better. So if you have to go to a fancy party for next 2 3 days, that's not the treatment you want to do.
Fair enough. Fair enough. The swelling does last a little while, but the results are amazing. All the ones I've seen are
the
really, really
benefit
nice.
is like it's even not breaking your skin. It's just something you're injecting quick and easy within 5 minutes, and you can get your sharp jawline or get it up for double chin. Not surgically, which we didn't have before.
Yeah.
Yeah.
So with the fillers, how long does this procedure take?
It depends. I mean, if you're just doing one syringes of the lips, it takes less than 10 minutes. I mean, of course, the whole procedure can last up to 30 minutes because we are bringing you in, we are talking to you, make sure we are on the same page, we are taking your pictures, consent. But procedure itself does not take very long. I will say though, the fillers. You have to plan so that it can be it can take some swelling and bruising. So please plan your filler like I said. If you have a fancy party to go to, like the Halloween party,
Halloween party, you might fit in.
Yeah, exactly.
Plan for a couple of days of swelling, bruising, and of course you can ice as much as you need. So okay, so perfect. So we have make sure if you have not liked or shared yet, make sure you like and share. Oh, it's closed. Okay, so it is closed. So we are going to pick someone for the hydrofacial raffle. Dr. Mira.
Okay.
I know. There's a bunch of names in here.
I know.
Let's see
Thank
who.
you so much for liking and sharing.
So who won?
And it's Nikki.
Nikki Wright. You are the winner of the hydrofacial. Yay! So exciting. So I'm assuming we'll put that on your account.
Oh, Nikki, here is the share. So
She
you are
shared.
going to get a free hydrofacial. I love the treatment. I think you're going to enjoy it. You're going to like it a lot. So I think we are going to the end of our event. It's we are in the end. So if you have any questions, please feel free to ask but again, if you're not sure like how much filler, where you want to put it, what type, we have a couple of days, so you can make your consult, call us so that we can find out. And if you just want to take the advantage, we can always figure out later, we can exchange it and everything. So
yeah, so we just want to thank the reps because without this, it definitely wouldn't be possible. So we want to thank the Allergan rep and the SkinCeutical reps like you guys. Thank you so much because it wouldn't be possible without you. And then just to play off of what Dr. Mira had said, if you guys have any questions about fillers, definitely don't hesitate to give us a call. We are here to answer any questions you have, send you in the right direction. I know that this is ending on Saturday, these deals are. So if you're feeling like you don't know what you are or what you should be getting, we can point you in the right direction. So don't worry about that. So definitely give us a call. Are you posting specials again? Yeah. So the specials, $8 unit Botox. You have to purchase 50 units or more. Buy one, get one 50% off filler. Buy two, get one free filler. And then IPL, buy two, get one free. And then the same thing with the microneedling, buy two, get one free. So these deals are amazing. And then every $100 that you spend going towards these specials, you are going to get entered into the raffle, which we will be picking on November 2nd.
Yeah, and the raffle is whoever's going to be the lucky winner is going to get the whole liquid facelift. We're
Yeah.
gonna have 2 filler syringes, $50 of Botox, IPL, hydrofacial, chemical peel. That's going to be fun.
Yeah, it's definitely it's definitely a great raffle. So if you
Yes,
guys
but-
have any questions, please let us know. Give us a call, book a consult, and we'll see you next time.
Well, everybody stay safe.
Yes.
And I going to be happy Halloween, which is coming this Saturday. Go party, but be safe. So thank you so much, everyone, for tuning in. You guys are amazing. I appreciate your support. Any question, I'm here to help. Again, that's probably going to be our end of the event.
All right, guys, we'll see you next time. Bye. Should have passed her a glass of water.